Dr. John Vanchiere is here from LSU Health. Hey, Dr. John, how have you been? Thank you for taking time for us.
I'm doing good. How are y'all?
So, West Nile, it's that time of year. I was just saying to Erin that you haven't read as much about West Nile and the mosquitoes as we have in previous years. Is it less of a threat this year, about the same, or more?
Well, we're not seeing too many cases at all. In the United States, there are only 67 cases reported by CDC so far. Now, we know that West Nile usually is going to peak around Labor Day, so, we're approaching the busy season for West Nile virus. But in Louisiana, we've not had any cases in humans, but there has been some West Nile reported and detected in mosquitoes and I think in birds.
We just got a report yesterday saying that there were some cases, and one was in Bossier Parish. Are those reports lesser cases, or what do you have?
Yeah, I'm not aware of those cases. CDC's report as of the 25th, 3 days ago, was that no cases in Louisiana. So maybe the state has more recent data than the CDC does. But I'm not
Dr.
aware.
John, about the last week or 10 days, maybe a little longer than that, I've got a bunch of friends who all of a sudden are coming down what seem to be summer colds. They're coughing. It seems like allergies. Mm-hmm. Is there any way that could just be mild West Nile?
West Nile is not going to present with respiratory symptoms. So remember, only about 1 out of 5 people who get West Nile actually have any symptoms at all. So 80% have no symptoms. 20% will have a mild fever. It's usually kind of muscle aches and just not feeling well. Kind of maybe flu-like, but not so much respiratory.
Dr. John, if so few people who have West Nile, who contract West Nile, actually show symptoms of said disease, pardon my naivete, how do you know they have it?
Well, we can do blood tests to detect your immune response to West Nile virus. And so, remember, West Nile virus now has been in the United States since 1999 and in Louisiana at least since 2003. So most of us, or at least many of us, likely have immunity and won't get sick because we've already been exposed to it, and our immune system can protect us from it now.
Still traced to mosquitoes, correct?
Yep, comes from mosquitoes, transmitted from mosquitoes, and birds are the primary reservoir in nature. Prevention
efforts. I know you want to go over that with folks.
Yeah, prevention is always, the important thing, which is, stay away from mosquitoes, meaning dusk and dawn especially, but use mosquito repellent containing DEET, and up to about 20-25% DEET is plenty, and that'll last 4 to 5 hours when you're out in the environment.
Dr. John, that 20% of people who West Nile adversely affects, is that a specific demographic, the elderly, the less than healthy, et cetera?
The 20%, no, but the 1% or so who get more severe disease, neurologic disease, that tends to be, I won't say elderly because it tends to be people over 50. And there is it's more likely to happen in people who have chronic diseases like diabetes, so especially diabetes, maybe kidney disease, other things like that. So it will pick on the people who are a little more vulnerable. Tends to be
immunologically challenged, so to speak.
That's a good way to put it. Sure. Yeah.
Children too, I would assume.
Children, not so much. I mean, kids can get sick with West Nile, but the sickest is usually older adults, not children. Pediatric cases are much less common than adult cases.
I have always been told, and I know this is a silly question, but my father used to tell me when I was a child that mosquitoes like to bite me because I was so sweet. If a mosquito bites me, how worried do I need to be? Because they bite me all the time.
Well, you are so sweet, and that's what they're after. If a mosquito bites you, you don't have to be particularly worried because remember, the vast majority of people don't get any symptoms, and probably most of us, or a lot of us, are already immune to West Nile virus because we've been exposed to it.
Dr. John, I did see an article a couple of days ago. Erin makes an interesting point. I did see an article, I think, a couple of days ago that there's new evidence that mosquitoes, in fact, are drawn to some people over others, that some people are better targets. This is legit, right?
Yeah, that is. There's a growing evidence, and it's interestingly, I was looking at this topic yesterday, and that seems to be related to what type of bacteria are on your skin.
Uh-oh.
So,
are you calling me dirty?
No, just bacteriological.
No, we all have bacteria on our skin all the time, but some of us have, different flavors. Let's just leave it that way. And the mosquitoes like particular flavors of bacteria.
But
what flavors do they like?
But as the evidence grows...
Rocky Road?
The Bluebell. As evidence...